Okay. Good morning, everybody. My name is Jyoti Sharma, and I am the founder and CEO of TaraCares Global and a principal investigator for the NIHR, National Institute for Health and Care Research, UK. TaraCares is a London-based health tech startup that's leveling up the science for healthy aging. And today we have a very special guest with us, Dr. Vikram Talawalekar, and I'll hand over to Vikram to introduce himself before we go further. Over to you, Vikram.
Thank you, Jyoti. Thank you for the invite. My name is Vikram Talawalekar. I work at University College London Hospital as a menopause specialist. I'm a BMS accredited menopause specialist. I also do a little bit of research related to women's health. That's primarily through University College London in the Institute of Women's Health. So great pleasure to take part in today's video. Thank you.
Thank you, Vikram. I think I would add it's not a little bit of research, Vikram. You do a lot of research, and we are so grateful for the work that you do.
Thank you.
So for our listeners, today we are going to discuss about our solution MIMOSA, which is designed to deliver evidence-led, inclusive, and safe experience through all types of menopause transition. And we decided to do this because Vikram has been a clinical advisor through the development of the product to make sure we are on track with the scientific information, but also helped us test our latest innovation in the platform, which is called Safe Space. Now, why Safe Space was built is because no two women have the same menopause transition experience, and we're going to discuss about it a bit during the call today. More importantly, as of April 2023, at least 6,700 women in England were on waiting lists for menopause treatment. Now, that's waiting an average of 232 days, which is more than 7 months for referral to a specialist clinic. So once you go to a GP, what that means is if you have to go to someone like Vikram to investigate further what you're going through, you are waiting for more than 7 months. And what we want with MIMOSA is we want MIMOSA to be your personalized GPS, so for you to tackle misinformation, misdiagnosis, and mismanagement. And to solve this problem, we built Safe Space. What is Safe Space? It is a responsible AI co-pilot that is informed by 4 years of research, and we are continuously enhancing it with ongoing research and the needs of our customer base. Safe Space can be used by individuals, women and female individuals, line managers at workplaces, and menopause champions who are supporting women going through the menopause transition, as well as GPs and private clinics who see women through at any stage in this transition. So let's get started. So Vikram, the first question I had from you is, the variability in menopause transition and hence the need for scientific information. Could you shed some light on this based on your experience and what you see in your practice?
So as you already alluded to, Jyoti, there remains a wide variation between individuals as regards to what their overall menopause journey is. So we know, for example, that about 90%, 85-90% of women or individuals will have menopause around the age of 50. However, there'll be 10% who will have it between 40-45. There'll be 1 to 2% who will have it below the age of 40. There'll be others who will experience menopause because of medical interventions, surgical treatments. So everyone's menopause cause or reason why they go through this journey is different. If you look at the symptoms, then there's so much variation. An individual may just experience one symptom. Others may experience 10, 15, 20, up to 25 symptoms. Overall, there are more than 30-35 symptoms of menopause on its own. Then you have the duration. So a woman may be lucky and may just experience it for 6 months or a year, but there'll be others who will go on with menopausal symptoms for 15, 20, 25 years, even until the end of their life. So a lot of what we thought previously that menopause happens at 50, lasts for 2-3 years, and then the worst is over, may not be applicable to a large proportion of individuals. What we miss out on right now is giving that tailored individual information. Is because what we have come up with information resources or other sort of useful information resources, they all concentrate on a typical picture, but they don't give you the individualized information that that particular person may be looking for. And I think that's where we'll talk later in the video about how MIMOSA has evolved and what we aim to achieve through it. But yes, there's a wide variation in the whole journey for every individual.
And which means that their need for knowledge and information is different. And
That's right.
also, even for a particular individual, that need evolves, right? Because it may start a certain way and then it
Absolutely.
may evolve with their, we have around 29 determinants of health, including ethnicity and socioeconomic backgrounds and medical background, and, in the platform that helps women understand what they're going through.
Yeah.
So, in terms of the benefits, and right now, maybe this is something important to bring out. Is right now, what are the various sources? I mean, I see women going on Google, TikTok. Yes, there are good information booklets out there, but I also argue, Vikram, as you mentioned, is that it is aligned with a typical use case, and it's also static, right? So when folks like you and our research team at TaraCares, and we are doing a lot of the research, that's not, we need a way where this is being fed to people in real time.
Mm-hmm.
So what do you see? How are your patients getting their questions answered right now, other than coming to you and
Yeah.
spending that, if they have the economic power to go to a private appointment?
And that point is very important because it's important that if someone is looking for information about perimenopause, menopause, what they're experiencing, what do they expect in the coming few years, what sort of management option they should be looking at if they are asking for help, the worry is there is a myriad of resources. Some are very
Mm,
good and some are not good. And it's very difficult for women or individuals to actually know which one to trust.
mm,
So, for example, many women now get their information online or through internet-based other resources. Yes, there is a mixture there. You could have some very evidence-based resources, but you could also have very personal viewpoint-based resources, which may not always be evidence-based scientifically.
mm,
So women struggle to know which one to trust when they read something online. You've also got now other apps. You've got books which have been published, a lot of them on menopause in the last few years. Yes, you've got useful patient information leaflets. Again, the quality varies. You've got very high quality PILs, but you've
mm,
also got some which are not fully evidence-based.
mm,
What I think has been missing so far is a personalized one information source. So if I am, say, from particular ethnicity, I
mm,
don't identify myself with the large chunk of information that's out there. I am of a certain age, which is not a typical menopausal age. I'm getting symptoms which are unique to me, to my situation. I've got a certain medical history that's unique to me. Where do I go in those all sort of situations? I
mm.
can't go to a generalized source which tells broadly about menopause. So I think the whole aim of trying to get to a better resource available will be to try and get this particular platform where I can feed in what I want, what my
Yeah.
wishes are, what my journey is, what my symptoms are, what my management options should be. And then it gives me tailored information. That will be a fantastic resource to have.
Okay, so that then brings us to you've tested, well, you helped us in our design and development of Mimosa, and you've been, helping us with the quality assurance as well, and you've tested safe space. So my first question is, what was your overall experience testing safe space, from the perspective of accessibility and usability of the platform?
So in one word, if I have to summarize, it was wonderful, much more than I'd expected from the platform. I was a big skeptic because I don't have any specific technical knowledge of AI or how the platforms
Mm,
work. I'm
mm,
just an ordinary clinician sitting in my clinic room seeing patients. So
mm.
I was wondering, what will the AI platform say when I ask some tough questions? But I was
Right.
pleasantly surprised. And again, people watching this video, I have no financial interest in the company, no
Correct.
interest. I don't get any money from this particular platform. But it's my honest opinion that when I did test this platform, I was trying to ask some difficult questions to see whether anything related to hormone replacement, women's health symptoms, menstruation, menopause, what can be the different ways menopause can present, what are the current recommendations for non-hormonal alternative therapies or hormones. and it gave me really good web-based, evidence-based information, trying to quote information from sources which, as clinicians, we would trust. So it was
Yeah.
looking at places where one would go to as a non-biased, non-financially influenced information. And that's exactly what I got with the questions I asked. So very happy with how the platform found the right information to the questions I was asking.
I love that, Vikram. And yes, to reiterate, when it's not financially motivated is very, very important in the day and age where we live, where, people have commercial interests in most of the activities that they're doing. And I'll pass it on to our development team as well, and the research team. So the next question I had is, what's the benefit you see for you've mentioned, in terms of tailored advice. So we're going to talk about two use cases. One is there could be an individual who wants to be informed, say I'm
Mhm.
44, even if I don't have any symptoms, with all the conversation, I know that my body is in perimenopause, but I don't feel the need or haven't decided for a clinical appointment yet. Or I could be a 32-year-old who has been given a diagnosis of POI or premature ovarian insufficiency, and they know that their perimenopause is going to be earlier than other women. So the first one is, what benefit do you see for women in this group, for them to use a safe space, Vikram?
So again, it's individualized information. That's the key. As you gave us two examples, Jyoti. So a lot of women in their 20s, 30s, 40s who are having regular periods, who are busy with their life, their career, they're busy with day-to-day things and having their periods regularly, may not want to know a lot about menopause, may not be thinking about it because they have lots on their plate already.
Yeah,
And menopause usually then becomes an issue, or they really start thinking about it when some symptoms appear, let's say early 40s, late 40s, and 50s.
yeah,
But that's changing now because what people have found is that the traditional concept of menopause being a 50-year-old person's or individual's issue is not true. You can do a lot of things in your lifestyle with relation to your general health, which may actually help you when you hit perimenopause and menopause later on in life.
yeah,
So, as you rightly pointed out, a lot of women want to read about it. They may not act on it now, but they want to know what to expect when I'm between 40, 45, what to
yeah,
expect when I'm 35 to 40. And that's exactly the information that they can ask directly to the platform.
yeah.
Similarly, you cited the case of POI. There is so much lack of good information in relation to surgical menopause or premature menopause. Very little out there. It's mostly technical or scientific. So women often have to ask peers or friends, or they have to go to charities who are usually a very good source of information, but not everyone is comfortable accessing charities, for example. And so often if there is an independent individual source that will tell me really concentrating information just about premature menopause. I don't want to know the risks that menopausal
Right,
women have. I
right,
want to know what my risks are on HRT, which are
right,
completely different from a woman above 50. If I
right.
can get that information sitting at home from a reliable source,
Yeah.
that makes the difference. That's exactly what we are hoping for.
Right. Perfect. And as you mentioned, it's all about healthy aging, right?
Yeah,
So I have a lot of 20-year-olds and 30-year-olds who love the platform because they said, oh, wait a minute, I can actually make different choices right now, so that I can have a smoother transition. So
absolutely.
now let's talk about those women who have identified some symptoms and they have a clinical appointment that's coming up. For our listeners, we of course have prepared for appointment module within the platform that helps you to make note. Let's say
Yeah,
you're waiting for your appointment 2 weeks, 4 weeks, and you are making note of those symptoms in addition to the symptom trace that you get across your physical, psychological, nutrition, and other self-care steps that you might be taking. So how do you see how can it lighten your workload, Vikram, as well as a
mhm.
clinician, right?
Yes.
If clinicians can do 30-minute appointments instead of 45-minute appointments, if they have an educated patient. So how do you see that benefit as well, for the
Absolutely.
patient?
Absolutely. I mean, anything that can really reduce the requirement to go through a lot of information in a small chunk of time, which is what happens at clinical appointments. So GPs have maybe 10 minutes, 15 minutes appointments. For us in the hospital, often it's half an hour, 40-minute appointments. And menopause, however amount of good effort you put and you try to fit it in 40 minutes, it's not a 40-minute subject. You've got so much to go through, the background history, the symptoms, the options are multifaceted, hormonal, non-hormonal, alternative, but lifestyle factors to concentrate on. And all that in 40 minutes is a challenge for the healthcare professional, but also for the woman or the individual. If you have something like an information resource where they've already visited, they've tried to ask questions which they would normally ask the health professional, they've got chunks and bits and pieces of information which are evidence-based. Now it's about making a choice of one over other. Then almost 70% of your job is done. You basically make a summary as an individual of the answers you got from the platform. Okay, I have asked X, Y, Z. I'm happy with 1, 2, 3. I may discuss these options further because now I want to know in real time when I see the clinician what they think about it. So the homework, the background work has been done to prepare that individual to make the best effective use of those 15 or 40 minutes. And that's exactly what we want to aim, because it's a win-win situation for both parties. You're going empowered, you know what your options are already. You want to double check that with your healthcare professionals, who will then make sure that you're using that information correctly.
Yeah, and that's where shared decision making can happen in the right spirit that we want. And now let's come to the last topic in terms of how can GPs use this? Because, you know, when you were testing it yourself and some of the other clinicians who were looking at it, they said, wow, I can use it, you know, in my practice. So
Yes.
tell us a bit more about to help, you know, any of the clinical providers healthcare providers that may be watching this.
So
How they
again, the
can.
first point is if you have used it in a shared way with the patient, your patient or the or whoever you are consulting has already used this platform, they would be better prepared and informed so they can have the right discussion with you, make the best use of your 10-15 minutes. From a health professional point of view per se, it would be a great resource because right now, often, let's say you're in a clinic and you want a certain question answered because it's out of your normal day-to-day remit in relation to menopause or any other area of women's health. You would have to actually take a step back, say to the patient, for example, I'll research on this. You'll have to visit a variety of websites, a variety of resources, look through books to get the information. With this particular AI platform, you could simply ask the question yourself. You will get the relevant information. And then if it fits in with what you know, with the research you've done yourself, that's great. It's saving you time, saving you resources, saving you having to look through different pages of internet. In one place, you have the information you need. And as you said, it'll keep refining. The best thing about the platform is today I'm looking at it and I'm getting answer A. Another 3 research papers may come in the next 6 months. If I go back to the same platform in 6 months, it's going to pull out that information and say my answer is slightly different. So in the real time, whenever you ask your platform and you're faced with a difficult question in the clinic, you will get an information that's relevant for that particular time. So that will be a big asset to have for the health professionals, especially the ones for whom menopause is something
The new topic.
menopause, yes, basic menopause is common, but the specialist sort of topics or complex care becomes an issue in a day-to-day clinic.
Yeah. And that's our aim, Vikram, that, you know, if this can help inform the GP practices and make them sharper, so it can reduce some workload to the specialist so that you guys can, you know, utilize your time in more critical
That's right.
patient cases or those that really need a specialist.
And hopefully that reduces the waiting list.
And that reduces the waiting list. Exactly. Perfect. Vikram, thank you so much for your time. So, to our listeners, thank you for joining us. And if you would like to try Mimosa, drop us a comment or send me an email on LinkedIn or a direct message, and we'll make sure you get access to it. Vikram, thank you for your help and thank
Thank
you
you,
for your
Jyoti.
time.
All
Take
the
care.
best.